It's one of the scariest things that can happen after birth, yet too many moms have never even heard of it until it's already happening. What exactly is postpartum hemorrhage, and how do you know if you're at risk? Let's break it all down together. Hi there, I'm Sarah Jennings, host of the Mama Method for Ubie Health. As one of the AI faces of Ubie's global network of over 1,200 medical providers, and backed by insights from more than 12 million users, I'm here to help you separate fact from fiction, especially when it comes to various issues around pregnancy, parenting, and family planning. With so much misinformation floating around online, it's more important than ever to get doctor-approved info you can actually trust. That's why everything I share has been carefully reviewed and approved by medical experts. So, let's talk honestly about something no one really prepares you for: postpartum hemorrhage. It's the #1 cause of maternal complications around the world. Put simply, it's when a woman loses a significant amount of blood after childbirth, more than 500 milliliters after a vaginal birth, or 1,000 milliliters after a C-section. That's about as much as a full quart-sized bottle of milk. And yes, it's as serious as it sounds. But here's what most people don't realize. Postpartum hemorrhage isn't always obvious. Sometimes it's internal. Sometimes the symptoms sneak up hours or even days after delivery. That's why knowing the signs is so critical. Sudden fatigue, dizziness, a rapid heartbeat, soaking a pad in under an hour, or even just feeling off could all indicate something more serious. Now let's break down the causes, because understanding them could literally save your life. Doctors often remember them using the 4 T's: tone, trauma, tissue, and thrombin. The first and most common cause is tone, more specifically, lack of uterine tone, something called uterine atony. This is when your uterus doesn't contract properly after delivery, so blood vessels that should be tightly clamped down stay open. This is exactly what happened to me after I delivered the twins. After a long labor, my uterus was overwhelmed and just kind of gave up. Not dangerous in my case, but it could have been. If you've had twins or triplets, a long labor, or even a really full bladder during or after delivery, these can increase the risk of uterine atony. Thankfully, treatments can be as simple as fundal massage. Yes, an abdominal massage right around your belly button, plus some medications that help the uterus firm up and contract properly. Next is trauma. And no, not the emotional kind, though that's real too, but physical trauma to the birth canal. A fast delivery, or one that involves tools like forceps or vacuum extraction, can lead to painful tears or internal bleeding that isn't always obvious. One sign to watch for? Bright red bleeding even when your uterus feels firm. That could indicate a hidden hematoma, and it needs immediate medical attention. The third T is tissue, specifically when bits of the placenta are left behind in the uterus. Yes, even tiny fragments can throw off the entire healing process. Your uterus can't contract properly, which again leads to bleeding. This is why your medical team inspects the placenta carefully after birth. If anything's missing, they step in early. And then there's thrombin. This one's about how your blood clots. Certain conditions, like preeclampsia, eclampsia, or a known blood clotting disorder, can prevent your body from stopping bleeding the way it normally would. If you've ever been told you have a bleeding disorder, it's so important to flag that early in your pregnancy so your care team can make a safe plan for delivery. Here's something else every mom should know. Postpartum hemorrhage isn't just an emergency. It can often be prevented or minimized with awareness and proactive care. Keeping your bladder empty after delivery, staying hydrated, notifying your provider of any previous complications, and trusting your instincts if something doesn't feel right, these small steps can make a big difference. If you're pregnant right now, or even just planning a family, you owe it to yourself to be informed. Worried about your own health? Start by checking in with the Ubie Symptom Checker at ubiehealth.com. It's medical-grade, doctor-approved AI is like having a full on-call healthcare team right in your pocket, always 100% free. And don't forget to like and follow for more doctor-approved info you can trust. From Ubie Health and from me, Sarah Jennings, your guide on the Mama Method.